Good morning, everybody. Lovely to see you all here. I'm very thrilled to be here. My name's Christine Barnes. Uh, Christine Barnes from the Bodyguard Clinic. I focus on complex health cases. And today I want to speak to you about post-viral recovery. So everybody seems to be overwhelmed with how to treat a virus, and you may be able to have a look back into some of my videos within the group on how to address that. And anything I'm talking about during these videos, please know that it's general information. So it may not all be the right fit for you. And if you're concerned or you've got some other diagnoses that you're navigating, please don't hesitate to reach out. You may require individualized treatment. But let's get stuck into post-viral recovery. So usually when we're experiencing a virus, and there's many different viruses, there's the current pandemic, but it could be Epstein-Barr virus or many of a great long list of viruses that we can experience. During your experience of the virus, often we're stimulating the immune system. So that can be very helpful. But once the virus is over, we actually don't want to continue to stimulate the immune system. We do want to support it, but if we continue to stimulate the immune system with immune stimulating herbs, nutrients, etc., we can create a post-viral syndrome. And that's what we don't want. Another thing that we can aggravate is autoimmune conditions or even create them. So once we've actually got to the other side of our virus, we want to switch up our protocol. And that way we're going to avoid any long-term issues, pardon me. Really, it's an opportunity for us to take our wellness levels to a higher state. Now, sometimes when we're on the other side of the virus, we can continue to experience sort of a knock-on effect with, slight bacterial infections that may not be a disease or a diagnosis, but we might be carrying bacteria excessively. In the case of influenzas, we sometimes overproduce mucus, and if we don't clear that out, we might be over the virus, but if we don't clear that mucus up, we can end up having that switch to bacterial infection, depending on what our microbiome status is. So if you don't know what I'm talking about microbiome, I've had the videos that talk about the microbiome. You can have a look around those and get filled in on that. And again, feel free to ask any questions in the thread below. Let us know whether you're listening to this live or whether you're listening to it as a recording. We'd love to hear from you, and we'd like to know how you recovered from your virus and the good, bad and the ugly. It's always good if we can all chat about these things and get the information out there to the greater world. So all viruses have a negative impact on the mitochondria. Mitochondria is a little battery pack that lives within our cells. It's actually quite beautiful. If you ever get an opportunity to see any of that in-depth look at what a mitochondria looks like underneath a microscope, it actually looks very artistic and very colourful. So I love the way the mitochondria looks and quite complex. So mitochondria can get some negative impact from viruses and from oxidative stress from viruses, from all sorts of things, bacterial infections. And what we want to do post-viral is we want to rebalance the mitochondria, get rid of excess overgrowth of bacteria, negative pathogenic bacteria, make sure we've got the right balance of beneficial bacteria. Lactobacillus species in particular are very good at supporting the immune system, and they play a very positive immune support. They're one of the foundations of immunity. And we want to do some post-viral recovery support and also correct and rebalance antioxidant status. So antioxidants, most people are familiar with as far as, having great skin and anti-aging, but it plays a role in our overall health and wellness. So one of the things that we can do post-viral is switch to a high antioxidant or rich, nutrient-dense antioxidant diet that's low in sugar. That typically looks like what people label the Mediterranean diet, but it can be expanded out beyond the Mediterranean diet as such. So we want rich antioxidant foods, and we want them easy to digest. So a lot of people are very pro raw foods, and there's nothing wrong with raw foods. It's good to include them in the diet. But when our body has been through a viral load, it can affect our digestion. So gently cooked foods helps pre-digest the foods and can make some of the nutrients more bioavailable. So consider that, and I think about capsicums. They're beautiful when they're gently cooked, and you can eat them warm, cold, as soup, and they just taste sensational. Now, that's just my favorite, but I'm sure you've got your favorite. So consider including antioxidants to an over accentuated situation in your diet. And, do that over accentuation for a few weeks or a month. I always like to think of recovery being a few weeks as a minimum and, a month. Now, if you've got complications in your health, you might need to individualize this, or you may need longer. So as I said earlier, reach out if you need to have a highly individualized approach. These are general recommendations. Stress. If you've been off work and away from the family and cloistered in your bedroom, recovering from your virus, don't throw yourself back into a full workload or even a full family commitment load. Please allow yourself recovery time. So keep socializing down to a minimum, as well as any other commitments that you may have just had to let go of because you were too unwell. So this allows for you to use that energy that you may be recovering to then be repurposed into addressing any of these concerns. Energy is required internally to recover the mitochondria, for example. And if we just go back into being highly stressed, whether it be our work or our family commitments, we then can have difficulty recovering. And recuperation is something that's highly underrated in our current society. I'm hoping in time that it does develop some value. So I really urge you to consider that recovery process. And again, that could take a few weeks or a month. For some people, it may take longer. And what we want to do is not only manage stress, but we want to be proactive about stress management techniques. Now, I'm going to drop into the links below a very simple 12-minute guided relaxation technique. I call it Express Relax to help support that process for you. And it's really just switching off the world and internalizing and taking your awareness to different parts of your body and different parts of the cerebral cortex that can create a relaxation response. And that relaxation response in turn supports healthy immunity. So you could do that twice a day, 3 times a day, or if you're a bit stretched for time, even doing it a few times a week would be helpful. So just, again, experience it, download it into your listening device, use earbuds. It's produced for earbud use. And just incorporate that in your day-to-day. It's 12 minutes. Do it before you get out of bed. Do it when you get in bed. Do it at any time. So that's just one of many stress management techniques. If you've identified during your illness that you've sometimes that being cloistered away and being unwell allows us that space to be able to go, hey, I've got some issues that might be coming up, and oh, I'm still upset about that happened, or you may want to be more proactive and actually inquire about those things. I do recommend, as part of recuperation, to even address some of those more psychosomatic, psychological things that can affect our immune system. Trauma, for example, plays a role in negatively impacting on immune system. So that's some deeper stuff that I might talk about further in future recordings. But today, I really want to talk about some real practical things that one can do. Hydration. Often when we're unwell, and especially if we've been too well, not well enough to even hardly eat or drink, etc., sometimes we come out the other side of that being chronically dehydrated. So slowly get back to an appropriate level of hydration. Now, if you've got kidney issues or any health issue or challenge that compromises your ability to drink, say, 2 liters of water, which is about, I think, 68 ounces. I haven't double checked that. You might want to do that conversion rate, but about 2 liters is what we're seeking. Now, for my weight, I need 2.5 liters. If you're quite small, you need less. If you've got a health challenge, you might need more or less. It's very hard to say what your individual requirement is. But certainly stay well hydrated. And if you've been through a period of less than optimal hydration, it can take a while for your cells to soften. And so the outer part of the cell can get a little bit crusty. It's not a technical term. They can get a bit hardened. And sometimes we feel like we're drinking that water, but we're not hydrating. And it can take time for that to get in and soften the cells and the hydration to get in on a cellular level. So do that over a period of time. And again, you might need that individualized, and reach out if you've got any complication that needs a highly individualized approach. Now, if you came into a virus with a pre-existing condition, let's say it was a little bit of mold infection, that is going to add to that mold infection. So you might find that recovery, post-viral recovery for you, might be to get stuck in and address comprehensively that mold infection. The same if you had any other fermentation style infection, candida overgrowth, any fermentation, over fermentation situation can be made worse. Generally speaking, because if we're overproducing mucus, which is the body's way to attack a virus, sometimes that can create an ideal scenario, especially in the sinus passages, where it's dark and it can be moist, very moist if we've got mucus stuck in there. So this is an opportunity as part of your recovery process to gain a higher level of wellness if you've had that predisposition of some of those fermentation type syndromes that you may have had. Sometimes we don't know that we've got those situations. So, again, we can look at testing if you want to, take the opportunity as part of your recovery process of, okay, what's going on with me now? I want to optimize and get as well as possible. We can look at that. We can have a look at your microbiome. I'll put a link in the thread of where you can either order that if you want to do self-treatment. Same with mold testing. You can order that if you want to do self-treatment. If you want to have that test but actually get treatment by a professional like myself, that's also open to you. So yeah, be aware of all of that. And that might be something we want to do a stock take of, which I often do with my patients, is just do a stock take. What do we know? What are your symptoms at the moment? What's historically been your predisposition to fall back to? and address that, identify and correct. It's a great opportunity. So what have we talked about? We've talked about high antioxidant foods, over accentuating them, making them easy to digest. Yeah, so predominantly cooking those foods because they're pre-digested and it makes them more bioavailable. Addressing stress, avoiding stress, managing stress, stress management techniques. Avoiding taking on too much of a stress load too quickly, getting back into real life, if you like, post having a virus. Addressing underlying issues that may have already been there but may have been made worse. And I don't know about you, but sometimes when I'm unwell, I want, foods that are not so good for me on certain days. And, we all let go and go with it occasionally. So sometimes that can also add to feeding overgrowths as well. So we want to get back on track with that as well. Now, supplement-wise, often when we've got a virus, we're, swallowing all sorts of herbs and nutrients and foods that stimulate the immune system. And that's a really helpful approach. But once we're post the virus, we should be changing that. If we continue to overstimulate the immune system, we can cause secondary problems. And this is where I see some people that are doing do-it-yourself treatments at home. They look like they're doing a great job. They're doing a lot of work, but they're taking it too far. Yeah. So I'm not saying that's you, but be aware that sometimes we can go overboard and we can have too much of a good thing. So vitamin D is something that is used and abused a lot at the moment. And it's important to get your vitamin D levels to an optimal state. Don't misunderstand me. Somebody with a chronically low vitamin D level, we want to work out why it's chronically low. Have we got low level of vitamin D receptors? Do we genetically have a problem with that? And we can test these days. Is it that we're not consuming vitamin D rich foods? Are we not getting our buttocks directly in the midday sun? Yes, I did say buttocks. That's what we need to get, not our face, not our arms. It's our buttocks that we need in the midday sun in order to be able to absorb that vitamin D. Lots and lots of aspects just about vitamin D. And again, I won't take a deep dive into vitamin D. But if you've been on high dose vitamin D during a virus, I would ask you to step back, maybe even stop it for a while. But of course, that depends on your case, what your vitamin D level is and what dose you were taking. I do suggest stopping, and generally I suggest stopping after you've been on high doses. Consume vitamin D rich foods, maybe checking in on your levels in 6 to 13 weeks, somewhere about there. And then assessing, okay, where's my vitamin D level now? And correcting that in order to maintain optimal wellness. Yeah, but please don't just randomly take a lot of that. Same with vitamin A. Now, vitamin A, I'd urge you to be cautious if you're in your reproductive years. High intake should not be done unless under supervision. I do use high dose vitamin A often, but we monitor, we know the case, and we need to be cautious when we're seeking conception. We want to have the right level of vitamin A, not too high, not too low for conception, and we need to be cautious in relation to breastfeeding as well. There are some cases where high dose vitamin A is very helpful, and vitamin A plays an important role in immunity. So definitely let's have rich sources of vitamin A foods, but maybe drop vitamin A supplementation post-viral because we don't want to overstimulate that immune system and it go into attacking oneself, overstimulated. We want to balance the immune system. So do choose vitamin A rich foods that are great for the immune system. These are organ meats. A lot of people get vitamin A and beta carotene mixed up. Beta carotene generally comes from vegetables. And yes, that can be converted to vitamin A. But some people have a problem converting it. So best to choose both vitamin A rich organ meats and beta carotene foods, which are rich in what? Antioxidants. So do both. Okay. So you can hear what I'm coming back to all the time. I'm cycling back to that diet. So if you think organ meats cooked in a beautiful bone broth or chicken stock with some lovely poached in chicken stock, antioxidant rich foods, beautiful meal. That's a great recovery meal. Also, some of that could be blended up, made into a soup. Easy, doesn't have to be complicated. Okay, so diet's important, supplements are important and can be very helpful during recovery, but we want to switch that protocol to a recovery. There are some herbal medicines that are very much focused on stimulating the immune system, way too many to mention here. So if you've been on immune stimulating herbs, identify them and switch those to possibly recovery style herbs, immune support herbs, and you may want to adjust dosing as well. Again, way too many to mention here, but be mindful, make those changes, please. Otherwise, we can end up with post-viral syndromes. Now, we also want to switch our supplements to mitochondrial recovery and repair supplements. Coenzyme Q10 is one of many of those, but there are also many herbal medicines that help them support the mitochondria. Vitamin A also plays a role with that. Lots of vitamin E, lots of nutrients. So I won't go into them all here, but just be mindful that we do want to support and focus on mitochondrial repair. Yeah. And that all can be done via diets, supplement protocol, herbal medicine. So you can see we can actually have quite a comprehensive treatment, but all of that needs to be filtered through how your symptoms are, how you're doing, energy levels. If you've got any residual cough, for instance, that might need to be dried up. Bacterial infections might need to be addressed, even post-viral. Okay, but the take-home message is don't continue to overstimulate ongoing your immune system. Now, some of the actions or that I like to take as a clinician is to check in once somebody's recovered and repaired, but just sort of assess all the symptomology, make sure energy has been lifted. If not, that tells us that either we may have still the virus a little bit active, or we may have some bacterial infection, or we may not have addressed the mitochondrial repair appropriately. So then, I change the protocol based on that. But some of the testing I like to do is basic. So a simple blood test to address and assess zinc, copper, selenium levels. Now, if you can't get that from your local GP, let's face it, all the medical establishments are overwhelmed at the moment. You can actually order that privately, and again, I'll place links in the conversation thread to do that. But that's something that I do with my patients when they're post-viral, if they're agreeable, is we have a look at that, because things like the recent pandemic, it's famous for those viruses that were involved and all their mutations for consuming zinc in high levels. Now, what that can do is that can leave you in a high copper, low zinc status, which then can produce things like problems with your digestion and develop high anxiety and leave you immune compromised. So it's good to check on those things. Selenium, you may have heard me talk about in previous videos, Facebook Lives. Selenium plays an incredible role in muscle function, in ligaments, in conjunction with estrogen, as well as plays a foundational role in immunity. And it's one of those guardians that we want to have at the right level, so they can play that guardian role in case we are exposed to viruses, bacterial infections, etc. So they're there to protect us. And getting our microbiome well balanced. We know from recent research that was done during the pandemic that those that had a good recovery were those that had a well balanced microbiome. That's an easy test to do at home. It is private medicine, and again, I'll have a link for you to test that. The the microbiome has beneficial bacteria, hopefully it's there, that specifically plays a protective role for supporting the immune system. Lactobacillus rhamnosus, and we want that in balance. We don't want it excessive and we don't want it too low. There is a whole umbrella group of bacteria. Again, I won't take too deep a dive because I don't want to take too much time up here in the micro information. I really just want to touch base with you and let you know post-viral recovery is important and important for our ongoing level of wellness. So microbiome, no matter what our level of wellness is, it plays such a foundational role. And you may have heard of fermented foods. We can over ferment. We cannot have enough fermented foods. So deciding how much should be in the diet, we can take a look nowadays at our microbiome, and we can actually be quite prescriptive, if you like, in optimizing that. And moving forward into our older age, or our third age, which I'm very aware of because I'm in my third age now, it's considered my third age in my 60s, is getting that microbiome well balanced and managing it, maintaining it. So really it is running the show. We have 2 kilos of microbiome approximately. So, you know, it's something that it needs our attention, it needs our support, and that is supported through stress management, the right diet, and of course we can correct it with supplements, etc. So that's my little touch base with you on post-viral recovery. My name's Christine Barnes from the Bodyguard Clinic. You can visit my website, thebodyguard.com.au. If your case is more complex than just post-viral and you'd like to talk further, you can book an introductory chat and we can see if we can work together. Of course, you can follow me. I have a public figure page, Christine Barnes M. Well. That's my master's degree in wellness, ND. That's my naturopathic qualifications. And of course, you know, tag me in the thread if you've got any questions that you have that are in relation to post-viral recovery. Always happy to help support you in your wellness as much as possible. I look forward to speaking to you again. Do let us know if you're watching this live or recorded. And, you know, if there are any things that you're interested in us sharing as far as education, support, ideas you've got, we're very open here. And our role is to help educate and support you. So have a great day and be well.